Hi, I'm Dr. James Choo. We're here with
Ken Hanicak.
and Ken is one of our patients here at Pain Consultants of East Tennessee. Let's talk about how you came here to begin with.
I've been here 10 years. I came from Florida, and the problem that I had was nerve pain down my leg and into my toe.
And primarily from your back, is that correct?
From my back,
yeah.
yes.
And you've had surgery before?
Twice
in your lower back?
Yes.
But you continue to have a lot of pain, is that right?
Absolutely.
You went through the program of having surgeries and then maybe even your last surgery. What did your surgeon tell you?
My last surgery that I had, I was good to go. Like literally I could do anything. But it didn't last long. In 3 months, that nerve pain came back again.
Yeah.
To haunt me.
Yeah.
And then, like I said, we've done lots of shots and stuff like that. But this stimulator is the best.
So let's back up a little bit. You had all these problems prior to the stimulator. We tried some injections, tried a little bit of medications, opioids, but you were still miserable.
Yes.
How was the pain affecting your life prior to the stimulation?
Well, obviously there's certain things that you can't do when you're in pain, and like just for the total person that I am, because I'm kind of active. I mean, I like to be active, but when you're in pain, obviously you can't. Even when you want to do certain things, you can't do them. You just can't.
How's your sleep?
Now it's better. I've never slept better than
before.
But before,
yeah.
Terrible.
Yeah,
terrible.
Up and down through the middle of the night.
In the middle of the
Couldn't
night.
get comfortable.
No, absolutely.
Yeah, and probably the basic day. What was your activity like during the day prior to the stimulator?
I was sleeping when I should have been up, and vice versa. The time zone, just everything with all the medication and everything.
And you're probably exhausted because you weren't sleeping well, and then
absolutely.
Absolutely. And probably a very limited day just because of your pain. Couldn't walk around, get mobilized, all that kind of stuff.
Absolutely. Now with this stimulator, and this has been 20 years in my life. This is it happened approximately 20 years ago. The thing is I'm actually getting up in the morning like a normal person, and going to bed and then waking up right around 9 o'clock in the morning, and I've never done that in the last 20 years of my life.
Well, let's back up a little bit then and talk about how you came to even think about doing a simulator, because that's a pretty scary thing. You've had surgery and you've had the promises that you were going to be better and you're going to be up and moving. 3 months later, you're back to where you started. So there's probably a lot of hesitation about doing something again for the spine, right?
Yes. I was a little hesitant, but I always feel like, hey, anything can happen. I mean, most of my, like I said, 20 years, things just never worked for me. They gave me shots, they did this, nothing ever really seemed to work. But like I said, when we tried this stimulator, this was just like altering, just changing my life completely.
Okay, so let's go back and talk about the trial. You had met the pain psychologist, right?
Yes.
Okay, and that was a pretty easy process.
It was.
You just answered a questionnaire, filled out some stuff, and then on you went, right? And then
it took longer to do that than it did for you to do your job on my back.
So then you had the trial, right? Step 2 is the actual trial,
yes.
Right? We placed the 2 wires in. You have 1 week to see how this works. Were you surprised during that week?
I was. I was very surprised at how well it worked and I didn't have any backaches. That was the other thing too, because I always had a backache. I mean, just a constant backache.
And that was the first time in how many years where you didn't feel that backache?
Like I said, it's been 20 years.
20 years,
maybe 20
long
years.
time. So you were like, this is unbelievable.
This is, it's like a miracle. I'm like, this is the greatest thing since apple pie. I mean.
So you did well with that trial, and we said, okay, you're a good candidate now to move on for the full implant. How did that process go for you?
That went well for me too. Again, like I said, I think the hardest thing is just not to be able to do the things that you would normally be doing
while you're healing.
While I'm healing.
Okay, let's talk a little bit about that, because it takes about 6 to 8 weeks to heal. There's not a lot of bending, lifting, twisting during that time.
Correct.
But once you get through all of that, you're back to square one. So you can do all of those things again. What was it like all of a sudden, 20 years, you not having the backaches as much as, and you got through that recovery period, and
Yes.
you can do whatever you want. Talk about that. Was that a big change in your life?
Oh, very big change. My medicine, I was on 120 grams of morphine a day.
Yeah.
And now I'm down to 45.
Yeah, that's amazing.
And
Yeah.
so I'm happy just in that aspect of just, getting lower dose in the medicine, obviously.
Yeah, and you were super motivated to come down on your meds, and we've been slowly going down the process with taking our time, right?
Yes.
But you have noticed that the quality of your life, without having to take as much, I'm sure has improved tremendously.
Absolutely. Thinking wise, in the brain, in the
Yeah.
body, in the spirit too. I mean, it really is just a fantastic thing.
Wow, that's wonderful. I appreciate you for being such a great patient, being patient with us through this entire process, and really kind of taking it on yourself to be so motivated. So we want to thank you for sharing your story, because it's going to help a lot of people. And to hear this, to give them hope, you're a real hero to a lot of other people that might be on the fence or just wanting to learn more. So we want to thank you.
You're quite welcome, Dr. Choo. Thank you.